Actually, I didn't choose medicine. My dad
You
chose
choose
medicine. My aim was to be a chef, pilot.
Oh, okay.
Way from being because I
Medicine.
love to cook. So I did that. Okay. One individual can treat how many 100 things. So really, maybe it's treating something, but it's not treating everything.
Everything, yeah.
So maybe your problem is sugar, and this is treating blood pressure.
Okay.
So you're cost 90.
Yeah.
0. You understand what I'm saying?
Yeah, I get it.
I wouldn't bank my hopes on just a baby draw. No. Sadness doesn't mean like you're there and you're crying. No, that is not it. That is if that was the case, then I'll be hugely depressed because I like to cry. I do something happens and I cry and I'm
Okay.
But for example, depression comes in either you can eat more or you can eat less. You lose interest in the things that you were interested in before. Your sleep changes. You have no energy. There are about 12 things, 10 to 12 things. I can't remember all the topics. So these are things that even when you go to your primary care physician, they're going to ask you all these things. Again, I think that we need to educate people that mental health doesn't mean that you are weak. It doesn't mean that you are a witch. It doesn't mean that you are, they see it as negative.
Yeah. I mean, some people even think that you are crazy.
You're crazy, yeah. And that's not it. That is not the definition of mental health. In a nutshell, this country is not an easy country.
Okay.
My first thing is to take care of yourself. Okay? Taking care of yourself is finding time for yourself to make sure that you are healthy. And you can do that by, 1, establishing a primary care physician. Okay. Do your regular checkups. Go to the hospital. Forget about the insurance. Find free clinical. If you don't have insurance, just go to free clinics. It's better than nothing. Mental health is one of the things that we Ghanaians have a wrong perception of. Educate yourself about mental health. Because it's a big part of you. It's a big part of your health.
If you're watching this video, chances are you've not subscribed to the channel. And I know this because about 80% of people who watch our content don't subscribe. Because the YouTube algorithm actually shows us the analytics. So I know. So if you have not subscribed, I'd like you to take a pause and subscribe to the channel, because that simple action goes a very long way to help us, motivate us to do what we are doing. Thank you. So welcome, Doctor.
Thank you.
So I guess we just want to learn a little bit about your background and how it ties into the conversation that we're going to have today.
Okay, no problem. So I am Na Adoko Alute, Dr. Na Adoko Alute. I was born and raised in Ghana.
Okay.
I did my medical school in Ghana.
Okay.
And then came here to do my residency and fellowship.
Okay.
By profession, I'm a pediatrician in terms of specialty.
Okay.
And I'm a pediatric emergency physician in terms of subspecialty or advanced medicine.
Okay.
My passion is for kids. I love the kids. Okay. But I've also come to a point of realizing that I do sort of advocate for a lot of people.
Okay, so like in Ghana, what were you practicing? Did you have any specialty in Ghana?
In Ghana, I just finished we do 6 years of medical school. Okay. And then after that, you go into internship or something called a house job. Okay. And you just choose one medical field and one surgical field. So I did pediatrics and what's it called? OBGY, and then came here. So I just did that and came.
Okay, out of curiosity, why did you come to America?
It's a good question. I think it's a very, very valid question.
Okay.
Maybe I should just say that, why did I choose medicine?
Okay, why did you choose medicine?
Actually, I didn't choose medicine. My dad chose medicine. My aim was to be a chef, pilot.
Oh, okay.
Way from being because I love to cook, so I did that. Okay. But when I did the 6 years of medical school, in Ghana, you could do your specialization in any of that. But at that time, the system was such that it didn't have a real structure where you know that when you're going to finish.
Okay.
So I looked at all my choices and I said, okay, I like the US in the sense that I knew that it is structured and in 3 years you'll be done with this, in 3 years you'll be done with this. And most of my colleagues also were into it. So I just decided
Okay, so
to go.
you saying that in Ghana, there is no clear cut structure?
So in
or
those days, let me
in
go
those
with
days?
this. Yes, it was
Okay.
like here, you know that when you're doing pediatrics specialty
Yeah.
training, you know that in 3 years you're done.
Okay.
There it all depended on a lot of stuff.
A lot of things.
Yeah, so
Oh,
it was
okay.
not clear cut when you're going to be done, and it is much improved now, though. Yeah,
Oh, okay.
yeah. But and during my time, it wasn't like that, and that was one of the major reasons why I moved. Yeah,
Okay. So people move for various reasons.
various reasons. Yeah,
And a lot of people, they move to America in search of opportunities, and maybe they get more than what they begged for or bargained for in terms of the challenges that they faced. Among these challenges will be health challenges. And personally, I've had conversation with people who complain to me about having eye issues, like skin problems, menstrual issues, and some guys talk about erection problems. And being someone who migrated from Ghana to here, can you address why, and then also being in the health profession, can you address why some of these issues do occur to people when they move?
it's something that is there, and I'm happy we are talking about it because people should know, and people are going through a lot, and yet they don't talk about it.
Okay.
And I'm happy you're using this platform to address some of these things. Wherever you go, wherever you live, and you move to a certain place, you're going to meet some challenges. As I said, coming here is a culture shock.
Okay.
In its own way, you know. I always say that the health system in the United States is very different from the health system in Ghana. The health mentality in Ghana is also different from the health mentality here.
Okay.
Now, the health system here, they have access to everything. Pretty much, they have a lot of stuff.
Okay.
They have more resources as compared to Ghana.
Yeah.
Now, again, when I came here, when I talk about the culture shock, it's like the lingo.
Okay.
I had to figure those things out. So if you're not even in the health system and you're trying to figure things out, it's going to be more difficult, right? And then in terms of, so for example, you know that we admit people to the ward in Ghana. Here, they will tell you that they admit people to the floor. So these are just a few things.
Okay.
But the other thing that it's a major thing is our health mentality.
Okay.
Our health mentality is in the sense in Ghana is that we wait till we get sick before we go to the hospital.
Okay.
And then here we do more prevention. You don't wait to get sick. You do your checkups and then you go from there. So this will lead us into why we have health challenges when we come here. Because most of the time we bring our health mentality into the system.
Okay.
Now, apart from that, the weather is also pointing towards that. Gives us some health challenges. Our lifestyle.
Okay.
And when we talk about lifestyle, we mean nutrition.
Okay.
Our daily activities, our work schedule.
Okay.
And pretty much that's what we have. It gets into it, and then we have to, it causes the challenges that we face here.
So I would like us to touch on the health care mentality in Ghana versus or like maybe outside America, preventive and waiting for the preventive and actually the treatment or correction. Like when there's sickness, and then we go to the hospital. So how does that affect me if I move to America?
Now, when you come into a system here where you wait before you go to the hospital, there are so many things that could have, if recognized early, would offset complications.
Okay.
And so a good example is people come here and the stress of this place, they end up having high blood pressure, but they don't know.
Okay.
Okay. Somebody will be there and all of a sudden, boom, he's dead or has a stroke.
Okay.
It's because he's been walking around not knowing that his blood pressure is high. So they only will go to to the hospital when they know that they are having headaches or they are having they are not feeling well. And actually, it has to be really bad before they go, which at that time may be too late.
Okay.
So that affects us.
Okay.
But the person who lives here knows that
It's supposed to
he
go.
go for checkups. So if you go for yearly checkup, you will definitely know that your blood pressure has been on the higher side. And they'll tell you to come again, let's check again, come again, let's check again. And if you realize that, then we then say that they will start putting on medication, and then it prevents what the complications would be, which could be a stroke, which could be kidney problems, and all this kind of stuff. So that is one of the major things in terms of our health mentality that affects us here. We wait till the very last minute and we end up with severe chronic diseases.
Okay. So within a year, like, what should be the optimum time that I go for a checkup?
So, for example, here, if you're a healthy person and you have no issues, then you go yearly.
Okay,
That
once,
should be fine.
once a
Yeah,
year.
that's for your physical examination. Yeah,
Okay.
yeah, for just a normal. When it comes to teeth, one of the things in Ghana, we don't do regular checkups for teeth or even eyes.
Yeah.
Okay. Now, teeth here, we do it twice a year. Okay. You go, they clean it for you, and whilst they're cleaning, they're looking for cavities, so that even if you have a cavity, you don't wait till you get the worst cavity and they have to take your teeth out.
Okay.
So they take care of it and fill it, and it's taken care of. So every 6 months they keep an eye on it.
Okay.
And then some people are living with glaucoma and they don't even know.
They don't know. Okay.
And one day they almost go blind because they don't check the pressures in the eye. They don't go yearly to check the pressures in the eye, and that's what happens. Yeah.
Okay. So I come from Ghana, and let's say when I'm coming, I came with ABB draw. So I'm drinking those stuffs, and I feel like I'm healthy and I'm all that. Do I still need to go to the hospital?
Yes, you do. You see, some of these ABB and don't get me wrong, we do have there's a name for it.
Concussion.
No, convention here. Actually, in the US, these things are coming up, in terms of ABB, but they have a different name for it. I'm trying to remember. Alternate medicine.
Yeah.
Yes, alternate medicine. Thank you. But the thing is with these alternate medicines that there's no research behind it. I'm not saying that it's not good. I think some of these things are good, but in order for us to be very sure about it, we have to know something about it. There needs to be more research into these things. And so some of people do some of these without knowing what the other side effect of it is.
Okay.
Unless you really know that this is it. And moreover, they take all these medications, all these concussions and Ibibidro, and at the end of the day, they're not even knowing what one Ibibidro can treat how many 100 things. So really, maybe it's treating something, but it's not treating everything.
Everything, yeah.
Yeah. So maybe your problem is sugar, and this is treating blood pressure.
Okay.
So you're cost 90.
Yeah.
0. You understand what I'm saying?
Yeah, I get it.
I wouldn't bank my hopes on just a BB No.
Okay. So you need to go to the hospital then.
You need to be checked.
Okay, cool. So then let's talk about the nutrition.
Okay. So as I said, one of our biggest issues is the lifestyle.
Yeah.
Our lifestyle in Ghana is very different from our lifestyle here, which includes nutrition and our activity and all that. Now, in this country, in Ghana, life is more relaxed.
Very.
But here, it is go, stress.
Yeah.
Some people are doing 2, 3, jobs to survive. How do you live like that, without, at the end of the day, stressing yourself and increasing your blood pressure?
Okay.
When do you get time for yourself? You're going on the go, because of that, you eat whatever you find. Maybe on the way, you buy a burger. On the way, you go to McDonald's, you go to KFC because, hey, I'm in a hurry.
Yeah.
I need to get on. Or if you're someone like me who's always on coffee, going to Dunkin' Donuts all the time, getting coffee and all that. So you won't do that in Ghana.
Yeah.
That is a huge life change in a lifestyle.
Okay.
Now, the difference in terms of nutrition, the difference between Ghana and the US is such that in the US, we have more processed food as compared to Ghana.
Okay.
When we talk about processed food, you've processed the food in such that you lose the actual nutritional benefits of the food itself. Okay. So we can take something, for example, like flour. Okay. Sometimes the flour is bleached.
Okay.
And that means you take some of the nutritional whatever out.
Okay.
And because of that, when you're using to bake bread and all those kind of stuff, that is not
It
healthy.
lacks substance. Okay.
When you go to Ghana, some of our foods, in fact, most of our foods, we have a lot of carbohydrates, but they are complex carbohydrates. When you say complex carbohydrate, we mean that it has fiber in it.
Okay.
So even though we eat fufu, we eat yam, we eat cassava, we eat plantain, it has a little bit more fiber than just plain rice and here,
So-
and the type of rice that we have in Ghana, those brown rice and those ones that are actually grown in Ghana are a little bit more healthier than the ones that we see, this jasmine rice.
Okay.
Especially the actual, I don't know whether the king, it's a rice we in Ghana. King,
okay. I don't know.
chinkafa or something like that. It's
okay.
healthy rice and,
Okay.
those kind of stuff. So it is much more healthier. So in Ghana, we have less processed food compared to the US where we have more processed food, which is easier to get and more cheaper.
Okay.
And so people tend to go for that.
Okay.
And therefore, once you do these things, you end up getting yourself into a cycle where you have a lot of carbohydrates in your system, unhealthy carbohydrates in your system, end up causing your blood sugar level to go up, also end up sometimes turning into fat.
Okay.
And then at the end of the day, raising your blood pressure, your sugar levels, ending up in diabetes, obesity,
Okay.
and then high blood pressure and high cholesterol.
Oh, okay. So now you're talking about carbohydrates, and this thing just came into my mind, where you hear people say that if you want to lose weight, cut your carbs. And for me, I eat a lot of carbs,
Which is typical of Ghanaians. Very, very, because most of our food is carbohydrate.
But I'm not putting on weight. That's the whole thing. I'm even struggling to put on weight.
So the thing is that it's not only the food, but your genetics. And you may be more active than somebody else.
Okay.
You understand me? Maybe you do walk, you do, this kind of thing. So obesity also has a genetic aspect to it.
Okay.
There's some people who come from heavy set. I come from a very heavy set family, especially my dad's side.
Okay.
They are very heavy set. So everybody's basic metabolism is different.
Okay.
Due to the genetics aspect of it.
Okay.
So you need to know who you are, where you're coming from, what your genetic base, whatever metabolism is. If you have low metabolic rate in your, then you're going to put on weight. Yes.
Okay.
I'm like somebody, because I have a friend that she eats more than I do. Like she eats a lot, but she's very skinny. She eats. She does. So we shouldn't get, even though our lifestyle and all that, there's also a genetic aspect to it. Yeah.
Okay. And then how does the weather also come in?
Okay.
In terms of the complications?
So in Ghana, we have like 365 days of sun, literally,
Yeah.
And sun is very good for your skin. It's good for the skin not good for the skin, but it's good for your bones in the sense that the summer activates the vitamin D in your body into the active vitamin D, which builds up your bones.
Okay.
So you have less joint pains, you have more developed bones and all this kind of stuff. As for example, a 60-year-old woman who has lived here is more likely to have bone issues compared to a 60-year-old woman who is in Ghana because of the sun. Yes, also. And so that makes a huge difference. Secondly, too, especially in this weather where it's dry, your skin, you tend to get dry skin, and these dry skins actually sometimes it causes itching and all this kind of stuff. So moisturizing, instead of like the normal moisturizer you do in Ghana and whatever, you have to moisturize more here, and then to prevent some of these skin. Again, especially for the woman, our hair breaks.
Yeah.
Really, really breaks because of the dry weather.
Okay.
And so sometimes it gets to a point where at the end of the day, some people get like, they end up having patches and those kind of things. In those kind of stuff, I would recommend that they go see a dermatologist. Sometimes they will help them and give them some of the resources or the things that they would need to help grow their hair again. Because whatever you use in Ghana is not what is most likely going to help you here.
Okay. So with the vitamin D issue, not getting the sun, how do we supplement that?
So you can supplement by taking vitamin D here. They put people on vitamin D all the time.
Okay.
Okay,
So
you should
like,
go to over the counter. You go to the pharmacy because you want vitamin D.
Okay.
Yeah, and they will get you it. Yeah.
if you have to take them every time, are there no challenges with that? Like,
No. You there. No, it's not one that has a side effect of. Yeah, it's not a big deal at all.
okay.
Yeah.
Okay. So then you're talking about like, I mean, you brought in hair loss, and it's kind of interesting. Like, almost not everybody, but like almost a lot of people that come here experience that, and so and then like you are bringing. So personally, I've gone through that. Watch a lot of YouTube videos. Try to get some of the materials to sort of use. But then it's interesting you brought up like that we should go see a dermatologist to how they able to help. I don't know, like if you can talk a little bit about that.
So, if you've tried, I'm not saying don't try what you can, and you can look up stuff and okay, this moisturizer is good. You can see black hair is different from white hair.
Okay.
So there are certain products that are good for black hair, and you can try. And if you've tried all these things and it's still not working, at that point you need a dermatologist who would help you see that, because they'll have to sometimes find the cause of the hair loss. You know, sometimes even though we think it's dry, and if it's dry, they'll tell you that okay, this is a better treatment option than what you've been doing at home. Okay. That sometimes it's not only the dry weather or whatever it is. It could be something else at that point in time. So that's why we say that encourage people to, if they're having issues with hair loss, they need to be seen by a dermatologist.
I just saw a video over the weekend, I guess, and then there was this man who was, I think he's from Germany, or he's from Ghana, but like lived in Germany, and then he was saying that it's not advisable for a black man to live in America for more than 25 years, and he said, and excuse my language, he said, like, if you do that, you are stupid. I don't know if there's anything to say to that.
I think I may differ a little bit from him. I think it's how well you take care of your body. Okay. Remember that in Ghana, I told you that we wait to get sick before we go to the hospital.
Yeah.
Here, it is prevention. So people who go back after 25 years, most likely they have not taken care of themselves. They go home and they look sick.
Okay.
Because they haven't taken care of themselves. They haven't been to checkups.
Okay.
They haven't prioritized themselves. All they did was to work and make money.
Okay.
Because that was their priority, right? And that's a lot of our mentality. We put health at the back burner instead of putting it in front burner. But if you've had somebody who has really taken care of themselves well, it doesn't matter whether they've lived here for 20 years or 25 years. Now, people in Ghana are as young as 25, 30, 40. They are dying.
Yeah.
It's become more rampant than you think. So what is the difference? The difference is the culture here is going there. So you can be as sick as anything if in Ghana, if you are not taking care of yourself. And somebody here who's actually taking care of himself will be healthy. So that is where my difference comes in.
So let's say I wake up in a day and I'm going through my day. What are some of the things that I can do as preventive measures taken?
Okay, so preventive measures taken, I will say, is that one, you need to make an appointment with your primary care, established primary care physician, with a primary care physician, and do your checkups. That is the first thing I'll tell you. 2, take time and be intentional of exercising.
Okay.
When I say exercising, I don't mean you have to go to the gym. You don't have to go and pay money for a gym, and you can do these things on your own. Workout. So going for walks and all that, but you have to be intentional about it. It is not this little walk, I'm going here. No. So you have to actually walk maybe 30 minutes to 1 hour or something like that. You have to be intentional about it. And the reason why I'm saying is that we are so busy that we forget. So you prioritize it. And that's self-care. That is part of self-care. You're taking care of yourself by exercising, and therefore you say, okay, Wednesday, I may have 2 jobs or 3 jobs. I may have to get one time or something like that.
Okay.
An example for me is that I don't have that issue. I don't work. I just work one job. But even when I go to work, we have our ER is so big.
Yeah.
If I get a chance, sometimes ER is like from one end to another end,
Yeah.
So I can do laps.
Okay.
I can do that because sometimes I go for 12-hour shifts and there's no way I'm not going to come back home and go to, no.
Okay.
So I try to use that. When I'm not seeing a patient, I may do 1 or 2 laps, and then, and maybe one lap is like 0.2 miles. Okay. So if I can do 5, 6, I've done 1 mile.
Okay.
And so like maybe I can put a timer or alarm on. So hey, it's time for this. So you just have to be intentional about these things. Okay. And as I say, you don't need a gym membership to do that because a lot of people are going to pay money for that, and sometimes they don't even use it anyway.
Yeah. Mm-hmm. So now talking about visiting the hospital and then appointment with a physician. So what if the person does not have enough money? So for example, I had a stomach issue. Mm-hmm. I went to the ER, and then I spent some few minutes there. They finally recommended a drug that was like less than $10. And when the bill came, it was like $4,000. Fortunately for me, because I'm a student, I had insurance, and the insurance paid $7,000. I don't know how that transition from $4,000 to $7,000. So, but then I feel like it's a lot of money. I mean, if I had to pay that.
Yes, and it is. So that's the thing about this health system. It's expensive.
Yeah.
The health system is expensive, but there are ways around it.
What ways?
Okay. So one of the things I'll tell you as a migrant that comes here, some may have insurance, some may not have insurance. If you have insurance, make use of the insurance.
Okay.
But sometimes you do have a copay, right?
Yeah.
And sometimes you are scared that the copay will come and it'll be high.
Yeah.
Now, especially for students, if you are a student and you're insurance, use it. Most of you don't use it because you think that you're going to. And if you go to the hospital and then they bring you a bill, you just tell them you don't have money. Okay. And they'll tell you to fill certain forms. And sometimes they'll find ways and means of it and then cut back on it for you. There are resources there for people who do not have enough money. That's the beauty of this country. So you do not shy away. Now, if you do not have insurance at all, there are free clinics. You just have to Google and find out where a free clinic is.
Is it going to be the same standard, in terms of quality?
It may not be, but sometimes if they find something that is really bad, they'll recommend that you go to the hospital. And at that time, you still can go in the sense that, again, if you don't have insurance and it's really critical, the hospital will figure something out.
Okay.
Yeah. But if you have, and let me go back to this whole emergency thing that you were saying, you know, emergency room is a very expensive room because it's supposed to be seen. You are supposed to be seen because that's where I work.
Okay.
I work in the emergency room and we see very critical cases. So in the critical cases, we do a lot. So once you go into the emergency room, you should expect that a lot, we have to bill for all these things. Okay. The emergency, even the space that you go into, they bill.
Okay.
The room that you're in, just being in that room, they bill for it.
Okay.
So if you have less, a little stomach ache, some nausea, some bit of a headache, some cough, congestion, and very mild things, I recommend that you go to urgent cares, which are cheaper.
Okay.
Much cheaper. You won't get such huge bills like $7,000 and all that. Yeah, it is so much cheaper. If you have a sore throat, you can go there. If you have a little cut that needs to be sewn, you can go to the urgent cares. Yeah, that's the difference between urgent care and emergency room.
If you have been watching up until this point and you've not subscribed, I would ask you to subscribe. And also, you can leave your thoughts in the comment section. Let me know what you think. All right. So one of the things that is prevalent among the African community or even the Black community is what we think, our mindset about mental health. I think that we come from an environment where it's like, you're not supposed to talk about your mental health and I'm okay, I got this and all those kind of things. And, living in America where there is a lot of stress, how do we... Okay, so from a health perspective, do you think that mental health is real? And how do we address
mental
it as
health
people?
is very real. And mental health is now becoming a heated topic.
So I was having a conversation with someone last week, and then the person told me that, oh, there's nothing like mental health. They are just making up for it.
Because that's how we've been brought up. You know, in Ghana, but right now things are changing in Ghana, to be very honest with you.
Okay.
There has been a lot of education, lots of information. I mean, in this country, it is a huge thing. But now in
Yeah.
Ghana, it is becoming one of they celebrate mental health days and all that. Ghanaians see, or most migrants will see mental health as weakness.
Yeah.
They portray it as weakness,
Yeah.
which is not the case, you know. Now, one, in terms of mental health, when you're coming to a different country, it is not your country. This is not the country you were born. That alone is a psychological burden.
Okay.
It's a huge psychological burden. Now, two, we come from a country where we live in a community.
Yeah.
Here, it is not a community. It's more of a lonely place. It's you and your family.
Yeah.
I'm not talking about extended family. It's you and your.
Immediate.
And if you come without any family, then it is you.
Yeah.
Right? We don't have that. Being alone, it doesn't help. Now, in addition to this, your work schedule. In Ghana, we don't really do night shifts. Yeah, there's a lot of night shifts here, and you work 2 or 3 different. People don't work 2 or 3 jobs in Ghana to survive. Here, people do that. That will end up you up in burnout, being burnt out, you know. And then you have to deal with the culture shock. Things are different. You have to deal with racism. You have to deal with all these things. And people just live through it, and they don't even think about it because we haven't been conditioned to look out for some of these things. And these end up with you becoming anxious, that you don't realize that you have an anxiety problem.
Okay.
You end up being depressed, that you don't even realize you have depression.
Okay.
Or you're burnt out. And sometimes you react in certain ways that you think about it, this is not who I am.
Okay.
It happened to me.
Okay.
You know, I work a lot. I just recently, because of self-care, I had to cut down. I don't do full-time anymore.
Okay.
Just to take care of myself and my mental health. You understand me? I'm half-time now.
Okay.
Just so that, because I reacted in a certain way, I realized that I was so burnt out that I easily got angry and just angry at everything in the world.
Okay.
Yeah. So it's real.
So now it's interesting you talked about the fact that you would have it without knowing that you have it. What if I don't believe in it? Does that still mean that I have it?
Yes. If you don't believe in it, the reason why I say that, if you don't believe in it, it is your mentality that you don't believe in it, right?
Yeah.
But it doesn't mean that you don't have you do not have the symptoms.
Okay.
So in your head, you think you do not have it, but you show the symptoms of it.
Okay. So I think you talked about some of the causes, right? And so what would the symptoms be? Some of the symptoms.
Well, it all depends on which one we are talking about. So, for example, in depression.
Okay. So we have types of mental health.
Oh yeah,
problem.
we do have different types of mental health. Yeah.
Okay.
So we have depression, you can have anxiety, you can have, so these are general things that you see. But you have specific ones also, like, which are maybe genetic, schizophrenia, bipolar, those kinds of things are different. But these ones are the ones that we sort of, because of environmental, we develop it, but we don't realize we've developed, or our past, or we develop it, you know.
Okay.
So depression is one of them, where maybe life situation around here, being lonely, not having a community to back you, you end up being sad. And you see, sadness doesn't mean like, oh, you're there and you're crying. No, that is not it. That is, if that was the case, then I'll be hugely depressed because I like to cry. I do something happens and I cry and I'm, you know.
Okay.
But for example, depression comes in either you can eat more or you can eat less. You lose interest in the things that you were interested in before. Your sleep changes. You have no energy. There are about 12 things, 10 to 12 things. I can't remember all the topics. So these are things that even when you go to your primary care physician, they're going to ask you all these things and screen you.
Okay.
And then they can pick it up. Again, the essence of prevention, recognition, you know. So it is not like the person is sad and crying that makes the person depressed. And sometimes depression can come in body aches. Yet when there's something wrong, my heart is beating fast, my this and that. They go and you can go to the doctor so many times, and there is nothing. We call this somatic symptoms.
Okay.
And it's all because you're depressed.
Oh, okay.
So that's why we say that depression is not a one-phase thing.
Stuff.
Yeah. Mm-hmm.
Our phases in life that we go through, like, so maybe losing interest in some of the things that we do. Is it that when these things persist, that is when we come to realize that?
It's sort of, there has to be a pattern to it.
Okay.
You know, and they have to put in all other factors too. They have to make sure there's no organic cause.
Okay.
When we say organic cause, that means nothing in the body that actually is
causing that. Okay.
Is causing that, you know. So they will look at all these things. So they don't just diagnose because you're having all these symptoms. So they put it all together before they make that diagnosis.
Okay. Is depression curable or manageable?
It's managed.
Okay.
So you see, depression, it's managed, and you see, you don't have to take, it's not every depression that you take a medication.
Okay.
That's what a lot of people have in mind, that I'm depressed, so I have to be on medication. No.
Okay.
Here in the US, almost everybody's on depression medication. But therapy, seeing a counselor, which a lot of Ghanaians don't like.
Yeah. No, so they don't like because why do I have to go and tell him my problem? What is he going to do for me? It's not going to...
It makes sense because of the mentality with which we come, again, health mentality, right? So there are certain things that the counselor, there's maybe something is happening to you.
Okay.
But you can't figure out what is causing that. Sometimes it can go to the deep root.
Okay.
And discuss with you and say that, oh, maybe because of this that I have ended up in like this.
Okay.
So the counselor you are there to talk about it, but the counselor is also trying to guide you to see whether there's a root cause of what is happening to you.
Okay.
Secondly, also, there are sometimes they help you give you coping mechanisms in order to help you deal with whatever you are going through. So you're not going because and I say, you know, and a lot of people do that, and especially men. Okay. This is more men than women.
Women.
You know, they don't want counseling because they feel like it makes them weak. And they don't want to say things. You're supposed to keep everything. You're a man, so you're supposed to keep it.
Yeah.
But at the end of the day, that alone is actually causing problems with you and your marriage.
Okay.
Look, that's why even when we come here, marriages don't work. Because sometimes these things, because the situation we find ourselves in is more tedious than in Ghana, it spills over into your family life.
Okay.
You know.
So you think that counseling is effective?
Oh, counseling is effective, yes.
Okay.
If you have the right counselor.
Okay. The reason why I love this, like, I don't think I believe in...
I know a lot of people don't believe in it. Yeah.
Yeah.
But again, it's our background, right?
Yeah.
Our mental, what we have been made to believe in.
Yeah. So, not to cut you, but I remember some time ago, someone told me that, Stephen, maybe you need to see a counselor. And I'm like, why? And then give a lot of reasons. And I'm like, okay. So like you go and they tell you a lot of stuff and then like ask questions and they will tell you that, oh, maybe when you were a kid, this happened and all that. And then they try to find problem from your past and tie it to it. So like, maybe that's not it. So what is the need for me to sort of go? And I think that a lot of people have the same mentality, you know.
What if it is? Because research has shown something called post-traumatic, that a lot of people don't realize that what happened in your young life eventually molded you into what you are now. You know, you may have some anger issues that you don't even know.
Yeah.
But the anger issues is coming from something else. I have this, it was my dad's friend. He's a professor, an architect. He's old now, and he's in Ghana. Okay. And the reason why I'm using him is because he's a male.
Okay.
He had anger issues, huge anger issues, to the point that one day he almost took an axe and killed somebody. But they went back into his life.
Okay.
And they noticed that It all came from there.
So how does knowing like that it came from this place help resolve that?
So it is not, you see, counseling is more of a guide to help you cope with what you are going through.
Okay.
It is not to cure you. It is not to tell you this is what you need to do. It's just to look at yourself and see, do a deeper thinking and go down to why am I acting this way?
Okay.
You know, and I believe it's healthy.
Okay.
And you see, mental health is part of health.
All right.
So it's the definition of health is body, spirit, and mental.
Okay.
All of this forms health.
Okay.
Your emotions.
Yeah.
It's all part of it.
Okay.
So when any of this is in balance, you are sick.
Okay.
You are sick.
So you talked about spirituality as being part of health. Can you dive in further a little bit for me?
I think that spirituality, when I say
Spirit, sorry.
yeah, it's okay. It is, let me go back to it. So it is physical, emotional, which is the mental, and then the spirit, kind of spirit. Yeah. So you know how whatever you believe in, which I'm a Christian, so I believe in that Christ is my, but your belief also affects your health.
Okay.
Because some religion will not permit certain things.
Oh, okay.
It doesn't make sense.
Yeah.
Let's take a typical Jehovah Witness.
Okay.
They will not take blood.
Yeah.
You understand me? Some religions even tell you that you don't have to go to hospital because you can be, Some religion will also tell you that you can't take vaccinations.
Yeah.
Even here in this country, now vaccination is something that they are fighting. So all these things, it's all coming from your religious background.
Your belief. Okay. The stress level is quite high because of like it's fast paced and all that. And for someone who cannot afford not to slow down, what's the best way to manage his
Why can't you slow down?
Like, I mean, so let's say you have a lot of debts, credit card debts, mortgage, bills, and all that. And what effective way can you go about that?
So one, you can slow down, but you don't have to slow down. Okay. Let me put it that way. You have 52 weeks in a year, right? You cannot work all the 52 weeks in a year. That is ridiculous. Taking a week off just to take care of yourself and reset will even makes you more productive.
Yeah.
You understand me saying? Yeah. You don't have to go anywhere. That's why people call something called staycation.
What?
Staycation.
Okay,
so you
staycation.
you're in vacation, but you're staying home.
Okay.
You don't have to go and waste money traveling, and all that stuff.
Yeah.
But you take your time, you rest, you read, you don't stress yourself.
Yeah.
So maybe every 3 months or every 4 months, you take 1 week off and reset. And then you go. Then you go back. That is self-care.
Okay.
Life is stressful, but you've taken some time off to sort of reset your body,
Yeah.
So that's one practical way of doing it. Keep exercising 1 to 2, 3 times a week.
Okay.
Because it helps your energy.
Yeah.
You sleep better when you exercise. And once you sleep better, you get more energy.
Yeah.
Yeah. But if you are going 2-3 times and you're just tired, it just accumulates. One day you're going to break down.
Okay.
And then find things that make you happy.
Okay.
Things that you do enjoy. And then find yourself in a community. So if we have like the Ghana community in Accra like this, it is very impressive.
Okay. So now talking about community or how and family and all that, like how should they help people who are depressed or going through mental health?
So I
say this to a story of one young man, like I think he was from Ghana, and then he was a policeman,
And he
shot
murdered
himself.
him. Yeah, he murdered himself. Okay. So I know the story. And I know the guy. Okay. I think there are many parts to it.
Okay.
It's not that there was no community support. There was community support.
Okay.
It's just that, again, no counseling.
Okay.
He had symptoms, and I'm sure maybe he was told to go and he never went.
Okay.
And sometimes, and that's why it is real.
Okay.
Mental health is real. You know, people are killing them. People in Ghana, people kill themselves.
Yeah.
So, and these are things that when you see as a community, as you see, you can encourage the people, those kind of people. You can surround them. You can tell them what, you can encourage them and recommend, but they will have to do it themselves, you know. But again, I think that we need to educate people that mental health doesn't mean that you are weak. It doesn't mean that you are a witch. It doesn't mean that you are, you know, they see it as negative.
Yeah. I mean, some people even think that you are crazy. Like,
yeah, crazy. Yeah. And that's not it. That is not the definition of mental health. Our definition of mental health and our depth of mental health it's not good.
Yeah.
That is why they're trying to have a culture change in that, especially in Ghana. And actually Ghana, they are doing much better than they used to be.
Okay.
You know, and if we do not, even if the Ghana people are doing, how much more we live here. Yeah. You understand me? You know. So we need to look at all these things.
Okay.
Okay.
All right. Thank you. So like you said you advocate for like people that come here, you have an establishment or...
No, I don't have an establishment. I just do it on just, you know. So a lot of people call me when they are sick. They say they've gone to help, and so I would sometimes just tell them, okay, do this. You understand me? If somebody's critically ill, I go to the hospital, and they because I understand the pathology, the background, they are able to communicate with me. The health professionals are able to communicate, and I can explain to the family exactly what, because sometimes the terms are a little bit big. They don't really, it's over their head. Yeah. So it's one of the things that I try to do. And I also encourage people, especially when I see that somebody's health is, doctors are made to observe, right?
Okay.
So for example, there was this kid that I felt like he had, you know, and I know when you are bent a little bit, we need to look out for something like scoliosis. Okay. So I asked you take your child to the hospital, tell your pediatrician this is what you see, and they will figure it out, you know. And then so when I see these little things, I sort of go ahead and give them directions.
Okay. All right. That's interesting. So any last word? I mean, the conversation is getting interesting. I have a lot of stuff to say, but because of time, we have to.
Yeah, we do have to. Yeah. Okay.
If you have any last stuff that you want to say.
Yeah. So, in a nutshell, this country is not an easy country.
Okay.
My first thing is to take care of yourself. Okay. Taking care of yourself is finding time for yourself to make sure that you are healthy. And you can do that by, one, establishing a primary care physician. Okay. Okay. Do your regular checkups. Go to the hospital. Forget about the insurance. Find free clinical. If you don't have insurance, just go to free clinics. It's better than nothing.
Nothing, yeah.
You know. Mental health is one of the things that we Ghanaians have a wrong perception of. Educate yourself about mental health. Okay. Because it's a big part of you. It's a big part of your health. And at the end of the day, if you have any doubts, any questions, go see a health professional. Okay. Okay.
All right. Thank you. Interesting. Okay. If you've been able to make it to this point, give me a thumbs up in the comment section. Let me know that you're able to watch the full video. And once again, if you have not subscribed, I'll need you to subscribe to this channel. We need to grow. I'm counting on you to do that. In the meantime, in between time, my name is Atuapia, and it's been exciting bringing you this discussion. So I'll see you. Bye.